All right, thank you for staying with us. Now, during the 8th Assembly, Honorable Seginus Oguns sponsored a bill seeking to ban public servants from traveling outside the country for medical care. According to him, once this bill is passed into law, our ailing sector will come back to life in a manner never experienced before, and our public officials will be left with no choice than to invest in our health sector. Joining us now is the Honorable Seginus Oguns himself. He will be talking to us about the bill. Good morning. Thank you for joining us on the program this morning. Can you hear me, Honorable Oguns? Honorable Oguns, are you there?
Hello.
Right. I hope you can hear me loud and clear.
I can.
All right. Now talk to us about what transpired when you put the bill across to your colleagues at the 8th Assembly. Why it didn't see the light of day?
Well, I guess it's the politics of the day. That bill, it took almost 2 years from first reading for it to be presented for the second reading after so much persuasion and follow-up. I remember then the then Speaker Dogara, when he even read it, and he read when the process is usually when it was first taken as first reading, he even exclaimed that, wow, why did it take this long? But we debated it and it went through second reading. But for it to come and it was referred to the committee, and then nothing happened to it. And then the chairman rules of business then had to invoke Order 17 Rule 3 sub 1G of our rule book to discharge the committee of its responsibility of holding the public hearing because they are taking months. So it's not supposed to be programmed for clause by clause consideration, which is committee of the whole. Then it was listed a couple of times, it would not come up. And before I knew it, the end of the 8th Assembly came and that was it. So it was frustrated, basically. And I would not necessarily say it was my colleagues alone, maybe even the civil servants. But in any case, I think Section 46 of the Health Act, President Health National Health Act, even forbids any public servant from using funds, government funds, to travel overseas for treatment. So we're actually trying to amend that act to make it more punitive. So there's already a law that does not allow public funds to be spent on medical tourism. So for anybody spending Nigerian money overseas right now, you should be ready for impeachment if we have a viable parliament. That's the truth. There's a law.
So have you pushed the bill again for this 9th Assembly?
Honorable Oguns, can you hear us?
Yes, I was breaking when you were speaking the last time. I didn't quite hear what you said.
Yeah, I said, have you pushed the bill again? Have you sponsored the bill again for this 9th Assembly?
Yes. I have presented the bill again. It's gone through first reading. Then the problem again is for it to be slated for second reading. I had pushed and followed up. Then we have weekly order paper. So the whole activities during plenary will be listed during the week. Then this bill was supposed to come out on a particular day within the week. I prepared for this, provided the brief. I came to the chamber, it was not listed. I went to the chairman, rules and business, who told me, well, that bill came in the last house and it was controversial. He's my good friend. And I told him, it's not your place to say whether it's controversial or not. It is for it to be debated on the floor of the House.
Exactly.
And it's for the House to say whether it's controversial or not. And he said it was okay.
So,
Honorable Oguns, are you there? We're having some technical challenges with the network there. So much to be said.
I was really impressed when I read the details of the proposed bill, and to think it was already proposed right from the 8th Assembly and we're still waiting this long. I think that a lot of Nigerians
it says a lot.
Yes. We should,
all right, we hear he's back on the line now. Honorable Oguns, can you hear me?
Yeah, I can hear you now.
All right, Nima, you wanted to ask a question.
So when you mentioned controversial,
yes.
So it's expected, sir, that this bill, of course, will not sit well with the people who take advantage of the hospitals abroad the most, and most of them are in the political class, the elites, and you know, civil servants of high management level in the federal civil service or even state civil services. So you would expect this. What did you do to sensitize the larger number of people who are at the receiving end of the abandonment of the system? That's the populace. What did you do? Because I was shocked yesterday when I found out this, and our producer was saying we had to reach out to you.
Well, I have reached out to the media and the civil society. They have copies of the bill. They had it in the last house. And I remember there was a battle. It was a battle for that to even go through second reading. And when it went through second reading, it was even carried in the news. It was in the news. You know, but like I said, nobody voted against it on the floor, or not too many people voted against it on the floor. But when you deliberately frustrate it from becoming law, what can you really do about it? The media were well sensitized and they took it, you know, but it was frustrated, and that is what's happening again. So now we are discussing it, but beyond here, what happens?
Beyond the discussion.
That's a big question, but you wanted to say something with regards to that.
Yes. So what I realized is after the conversation yesterday, I started asking everybody I knew within that understood the law and present and past legislators to help me understand what can Nigerians do if we have a bill of interest that we believe will be favorable to us, and we can see that the system at the upper chamber is stalling the process of passing that bill. And I was informed that, number one, even if the chambers pass it, the president can choose not to assent it, and that there are several bills that have been passed by the House of Assemblies that the president has not signed into law. That there is that part. And that, but for us as a people, if we desire this law to take effect, what we're meant to do is to raise the awareness level on all social media platforms, clamoring for the speaker to request for it. So the person that can request for this reading to go through, for this bill to go to second reading is the speaker. And if we let him know this is what we want and everybody is picking up concerning it, we can get him to go through
perhaps
second reading.
you throw that question to Honorable Oguns, because I hear he's back online.
Honorable Oguns? Can you hear me, sir?
I heard what you just said.
Okay, so I wanted to even...
That's one of
I wanted to channel this as a question this way, sir. One, I must applaud the fact that you pushed for this, and I want to say, how can Nigerians support towards ensuring this bill goes through the second reading and preferably gets passed into law?
Yes, from what you just have said, the last time person just said, if you sensitize the people enough and you compel the politicians to do the right thing, they will do it. After all, you voted for them. If we get people calling from constituencies, especially now the speaker, one, if everybody says, Mr. Speaker, not even from his constituency, he represents the whole country now, we want this bill taken. But in any case, let me reiterate, Section 46 of the National Health Act even forbids the president or anybody spending public funds on foreign treatment. That act is still in existence, 2016 Act. That's what we are just trying to amend to make it more punitive and to expand it. But there's already a law that does not even allow public servants to go outside and spend money from the government coffers. So if we really implement that, the president should be facing impeachment now. You know? But sensitization is good.
Use public funds.
So how do you determine public funds? Now, help us understand what you mean by public funds here. Because if you say that this is actually on the ground? How come it's not been effected? Because efficient implementation of laws has always been the challenge in this part of the world.
Somebody should go to court and demand that the president refunds every money he has spent. And based on this, and if he's flouting the law, the National Assembly should commence proceedings for his impeachment.
So why haven't you taken that up? Why haven't you taken that up by going to court?
Even a simple bill, I cannot get a simple bill to go through second reading in a chamber, in a house where I was elected to act and represent Nigerians and my constituency. You are telling me to go to court. You are a Nigerian. Go to court.
So if you, who is, holds some level of authority as a member of the House of Representatives, cannot go to court, and you're pushing a bill that hasn't gone as far as seeing the light of day, so what is the hope of Nigerians ensuring that this bill see the light of day or go to court at the end of the day?
Talking about now, there is already a law that is in existence that people can go to court for and enforce.
So civil society needs to get to work, sir.
Exactly. So
we need to get more.
I agree with you, Honorable Sir, that
he has done his own part.
That you have tried. That other Nigerians should be conscious and try to do.
The president will have to.
So something. So you've mentioned that there's an existing law that is contravened 200 times now that the president has been abroad. In this 200 days of his entire
he might not have spent the public funds.
No. The court will determine.
That was why I asked.
What is public funds?
What is public funds?
So public funds for his health payment, public funds for the flight taking, because we know, of course, you know, the court will determine all of that, but Nigerians should rise up and take action.
When you're asking what is public funds, let's assume that he's using his salary to go and...
Is this still public funds?
Yes.
No, I'm assuming it is not public. If it's a salary, I'm assuming it's not public funds. But is he going by private airline? Is he going by public airline, I mean?
Yes.
Or is he taking the presidential jet?
Yes.
If he's taking the presidential jet, that's public funds.
Yes.
Thank you.
If he's staying in Abuja house while he's there, it's public funds.
So even if you are using your own personal money, you are still using public funds.
Let me even add to you that if you're paid by public funds and you spend that money while you're in office in another country, I think it is public funds as well. So when you have your private business that we know, so and so, for instance, now we are president, you're from the farm. If the farm can
pay is funding their,
for private jets as well.
The number of
because when we play these games, you know why this thing is not popular is because a lot of Nigerians want to sit pretty and everybody's waiting when it's my turn. I don't want the law to affect me.
We cannot assume, though.
No. Why would this not gain the popularity that it deserves?
Yeah.
Seeing how much of this we are suffering, it should have, in fact, the bill should just pass itself in 2 days into law. Nobody should even object to it.
It should be one of those bills that goes through
committee
fast
level,
reading.
It was buried.
All right.
Quickly. Yeah. Honorable, I wanted to ask you, is there a way we can assist you effectively to get this bill passed? At least let's know that, okay, the bill has been passed and then it's now on the
implementation.
Waiting for absence.
Waiting for the president's signature. Is there a way we Nigerians, people of the press, Nigerians can assist you effectively to get this bill passed?
By doing what you are doing now, we need to discuss it, you know, and then we need to have a presence on social media. We need to energize the system and get everybody talking about it. But like I said, there's already a bill, there's already a law, not bill, there's already a law. Section 46 of the National Health Act forbids the president to do what he's doing today. Even if you say he's spending his personal money, he should let us know how much that money is, you know. So let us know, to know whether he's worth that kind of money. But there's no disclosure. So I think all these our senior advocates of Nigeria should be in court to first challenge that and then compel the National Assembly to start impeachment proceedings. Because this is flagrant abuse of the law that is in existence already.
Exactly.
Now, quickly, we need to know why you came up with this bill in the first place. What did you see that you ensure that you needed to come up with something that would stop public officers from going out of the country to treat themselves?
Well, if it was possible for you to play the YouTube version of the discussion of the debate on the floor of the House, which you will have a copy there, I explained clearly that those that voted for us cannot even use the public health system. If we can afford to go outside, those that voted for us cannot even afford, because there is no health system in place. So the civil servants that write the budget, they send it to the National Assembly to approve. The president assents, or rather to pass. National Assembly passes it. The president assents. It goes back to the civil servants. If we are all flying abroad for treatment, those that we are representing, we are less than 1%. Those that we are representing cannot even afford to go to a primary healthcare center, a secondary healthcare system, or even tertiary. The minimum we should do is to make sure that these ones are functioning. Then if you, not a public officer, a business person that wants to go outside can go. But you cannot be making the law. You cannot be passing the budget. You cannot be writing the budget. And you don't fund the healthcare system. When you...
Honorable Oguns, they're trying to...
He just hits a chord for me.
Yeah, trying to express
You're the one
there.
making law, but if you fail to fund, you make laws concerning healthcare, but you fail to fund healthcare, and so you don't use healthcare.
Last year during the heat of the pandemic, a lot of these government people could not go abroad because how will you go? So they were forced to use our own healthcare system. They didn't go to general hospitals. So they went to private clinics where a lot of them died.
Yes.
And it still didn't teach them to come back and, the ones that remained alive, to fund the healthcare system. To, because health is wealth.
Absolutely.
A healthy nation, you know where we will go, that you can walk into the hospital, you can do everything you need to do in a general hospital. Look,
and there are several avoidable deaths that
I'm sure I've said it on this. I took my finger to a private, because I have, they call it something thumb. I forgot what they call it. You could get it when you are getting older. So I can't bend my thumb. I'll be writing too much. The guy, the doctor, private hospital, he was so callous. Yeah, we're going to operate on it. I see him. On this, my finger. I said, okay, thank you. That was the last. I never went back there. I managed my thumb, and I've been managing it. This is like 4 years on. I'm managing. Because that doctor, guess what? That doctor is no more in that hospital. He has gone abroad.
Of course.
The way he treated me, he will never treat anybody like that in his life. He will lose his job.
Yes.
He will lose his job.
So
there are no checks and balances in these hospitals.
It's a really sad development.
No checks and balances.
Really sad.
Even in the government hospitals, we have a lot of corruption happening.
Right. We need to quickly take this commercial break. When we return, we'll continue the conversation. Stay with us.
Stay tuned. Your View will be right back.